Hello and welcome. If your child has had a hard time talking or is not talking yet, and you have heard so many different opinions, some people tell you not to worry, others telling you it's autism, this conversation is for you because today we're going to try to bring clarity. Is it late talking or is it autism? Hello, my name is Dr. Lum Fundi. I'm a pediatrician and founder of Generational Wellbeing. And joining me today is Dr. Sree, a doctor that I really trust with this question. So I'll have her introduce herself and then we'll get started.
Hi, Dr. Lum Fundi. Thank you for inviting me today. It's a great pleasure and honor to be with you here today. To introduce myself, I'm a board certified pediatrician. My full name is Dr. Sree Ramakrishnan. I currently practice in Dallas, Texas. Not only a board certified pediatrician, but also board certified in integrative medicine. One of the passions is working with bringing in nutrition and lifestyle into preventative medicine as I take care of the kids every day.
Awesome. Thank you for joining me today.
Yeah.
And as you said, you do integrative medicine too. What
Mhm.
drew you to integrative medicine?
Integrative medicine has been my interest since medical school, trust me or not. So it was way back in 2000. It was even before I graduated from medical school. I was very moved and I was following Dr. Andrew Weil at that time, and I had read a lot of his works. And truly, it was a blessing, a dream come true for me when I completed the fellowship with him just recently. And so it is something I have been looking for a very long time. And what drew me to integrative medicine is I wanted this holistic approach to the patients that I care for. So that has drawn me to not only look into just the integrative medicine aspect, but also it drew me into Ayurveda. So I am a certified Ayurvedic lifestyle consultant also. And just to give you an idea, what is integrative medicine? A lot of people ask me this question, even doctors ask me this question, what is integrative medicine? And I know Dr. Lum Fundi, you yourself are an integrative medicine provider. And I'm glad to be in the tribe with you. So it is a preventative and healing oriented medicine that is looking at a whole child. So we're looking not only the diagnosis of a symptom or just a treatment of a symptom, but we're considering nutrition. We're looking at sleep. We're looking at the emotional well-being of the child. We're looking at what are the family relationships, what are the spirituality that this family has. We're looking at the environment of the child. So we're looking at all aspects of the health. And we are also going to see how evidence-based we can go in recommending appropriate treatments apart from the conventional treatment that we usually recommend as a board certified pediatrician. So my focus is more on nutrition at this point, but also including all the lifestyle measures too.
Absolutely. Yeah. Thank you for actually explaining that because,
Mhm,
sometimes we focus on one symptom and forget that it's the
mhm,
whole child and the environment is
mhm.
important with everything else too, right?
Correct. Yes, yes, yes.
So let's get into it. So
Mhm,
in clinic, I hear all the time, maybe you hear
mhm,
you in
mhm,
clinic with a 2-year-old and the mom
mhm,
is asking you, my son is a late talker.
mhm,
Grandma says boys are late. Don't worry about it.
mhm,
But when I
mhm,
look on the internet, I see all these things about autism at my
mhm.
end. Like, help me, Dr. Shree.
Yes, yes. That's a really good question, to segue into our conversation. Just a little bit of a background. I would say as any other regular pediatrician, 20 years ago, we were not even trained well. I finished, my residency in 2008 and we didn't have a lot of training in autism. So all of this was, through other CME programs, a lot of curiosity involved in that. So there was something that piqued my interest in autism. It was not something I was doing it 10 years ago. I think COVID changed everything. So during COVID, when I was seeing a lot of the patients we had, kids who you would expect them to have normal development, but by 18 months, we see these delays in development or maybe regression sometimes. And that piqued me that curiosity into this field of neurodevelopment. And that question that you had asked is very important because now parents are understanding autism a little bit more than it was 5 years ago, correct? So, and now it's chat GPT, asking, answering all those questions. So it's such a really good question. But my answer would be ask your pediatrician, right? So you want to have a really good relationship with your pediatrician. Ask your pediatrician, like, this is my concern for my child. And what do I need to do for my child? So, and his grandma saying this, but I'm concerned with this, bring this to your pediatrician. And I think and just as we are trained, I as a pediatrician will never dismiss a patient a mom's concern or a parent's concern. So, but a general idea for the parents is by 2 years. So you told me it's a 2-year-old. So by 2 years of age, most children are beginning to combine words. So that'll be my question to her: is your child able to combine words? Saying "mommy go," "daddy come," "bottle please." Are they asking all of or more milk? Are they putting two words together? And are they meeting their developmental milestones? So usually when they come to the 18-month checkup, I'm actually putting red flags in the air. I say, hey, these are the red flags you want to look for as far as development is concerned. Watch for these in the next 6 months. So when you come back for your 2-year checkup, please let me know these red flags. You notice these red flags. There are a lot of websites that you can look into. If you're a parent and you want access to that, I recommend doing the Baby Navigator website. 16 signs by 16 months. So that's a good way to start for the younger kids. But for your question, yeah, if the mom is confused, I would have her to trust my assessment and guide her through my assessment. There's a lot of things I would say, there's a little, I'll add to that late talker thingy, because you said my kid barely talks, right? So then as a pediatrician, what am I looking for? One is I'm looking for, is it just an expressive language delay? Right? Or is it a receptive language delay? Like if you say something, is a child able to comprehend what you're saying? Third is, are they having good nonverbal communication? Like, are they saying, they are blowing kisses, they're saying, pick me up? Are they having a good nonverbal communication? That could be a good way of expressing themselves too. Are they responding well to name? That's a key thing. You call their name, are they consistently like turning to their name? And that is sometimes one of the early signs parents notice is they're not responding to the name. And are they having a good reciprocal communication, right? So you will see the joy in the eyes when you're communicating. The kid wants to communicate back to you. So do they have that good reciprocal communication? And they might not necessarily use words, but it might just be kind of like a social thing that they might do to communicate with you. As I said, it could be nonverbal communication skills. And also the other part is, you said your child is barely talking. Was he talking and now he's not talking? So that's another key point of difference. Is he regressing? Is a regression of skills? So I would look into those 5 aspects if they come with the speech delay kind of a concern, and any concern from the parent, be it even minor and not necessarily speech delay, I take it very seriously.
Yeah, thank you. And pretty much you've kind of started defining
Mhm,
autism for us, where sometimes when we
mhm,
see speech delay, if it's just only that speech delay, it may
mhm.
be delayed talker, right? But however, if
Right.
you're having this speech delay, there's no
Mhm.
social interaction with your parent, with the parent, because kids want you in your world. So if you have this kid who, like you said, not responding to your name, not trying to respond to you, interact with you, pick me up, and they want to sit in the corner and just be by themselves, that may
Yes.
be that social interaction is not there
Yes.
too, right?
Yes.
Yeah. What
Yes.
are the
Yes.
skills do you look at for kids who have eaten autism? Because we're starting speech delays one, but we also
Mhm.
talk about that social emotional connection with the
That's correct.
kids. Is there anything else you look out for in the office?
Yes. So we do, as pediatricians, we do the general screening, right? We do like there's a questionnaire. In our office, we do the ASQ questionnaire. We do the MChat. We also use the eye tracking technology, which is called eye contact for the early diagnosis for autism. But what are we looking for? We're looking for joint attention, right? For example, and it could be early on, we can figure that out. If you're looking at something that the child wants, is curious, what are you looking at? They might just turn their head to what you are looking at, right? Or you might be like just finger pointing, like, hey, look at the light, and be like, oh, what are you looking at? So there's kind of this joint attention. That's a nice social aspect that we're looking for. Another key thing I'm looking for is social reciprocity, right? So it's kind of like the serve and return. There is this whole video on serve and return. I highly recommend watching that from the Harvard University. It's that nice back and forth communication going on. That social reciprocity is key. We talked about response to the name. That's also key, and also about gestures and imitations. Like when you play peekaboo or pat a cake. Are the kids kind of imitating those? They might start imitating a lot of the things. Make a funny face. Or you make a sad face. So making all of those funny imitations too. That's a typically developing child. How are they flexible with those behaviors too? Like, are they like very structured, routine based, or can they be a little bit flexible with what's around them? Are they having like repetitive behaviors like flapping, or going in circles, or are they having any very rigid routines? Or are they having any sensory issues? Either they are hyper or hypo responsive to stimuli. You want to look into all of those aspects. Maybe this is the more commonly seen in social media, like, is my child going vroom, vroom, vroom with the cars, or are they just, stacking the cars in a row? So again, it's about the play skills, right? How are they playing with the toys? Are they playing with the toys purposefully? Are they doing the pretend play with those toys, or are they just using those as objects? So those are key things that you're looking at. So it's like socialization, communication, and flexibility, and routines and sensory stimuli. We're looking at all of those aspects too.
Good, good. And these are things too that parents can look if you're a parent too at home. Just that interaction with your kid will give you
Mhm.
clues to which way to go, what to ask your pediatrician. Because as a parent, you are with your child all the time, so it's easy for you to see, does my child interact with me at the dinner table? Can I talk to them? Are they looking at
Yes.
me? Are they giving me eye contact when I put them
Yes.
down to play? Are they bouncing on my laps? Are they looking at me? Are they following directions, like you said? So practical things that you can observe even at home with your
Mhm.
kid can help provide
Yes.
clarity to that question as well.
Yes, yes. And I think that's the reason why I personally saw more cases during that COVID times when the kids did not have that chance to socialize. So I think the more we have fun with the kids, the more we interact with the kids, their brain is, and this is true, the baby's brain is developing 1 million synapses a second. Like I snap my fingers, it's already 1 million synapses are developing. So that every second of learning is so important for those kids.
Yeah, and interaction, connection
Yes.
too. Yes.
Connection. Yes. Have fun with your child. That's very, very important.
Right. You did mention regression. What does regression have to play in it? If your child was talking before and then suddenly they stop
Mhm.
talking.
Yes, regression is very concerning. So you want to look at, is it a loss of just something minor? Like he said a word egg like maybe 2 months ago, and he's not saying that now. It's okay. That's not regression, right? But he was consistently saying something, and now there's a loss of skill, right? That's definitely concerning. You do want to bring that up to your pediatrician. Either if it just might not be language related, it could be social skills also. So any loss of skills is regression. So it could be language, it could be social skills, or maybe, how the child is interacting, maybe emotion wise too. So you want to get that evaluated.
Okay. Thank you. So, what would you respond to that grandma who says, "Oh, it's okay to wait and see"? How would you counsel a mom who's like, "Is it okay for
Mhm.
me to wait and see, or should I go ahead and start acting now?" When is it okay to wait, and when is it okay not to wait?
Dr. Friendly, you are asking such great questions. I really appreciate that. These are key things that parents need to understand. Because sometimes I, as a pediatrician, may be concerned for a kid too. Like I'm seeing some things and I might, want to get things rolling because in my mind, I'm thinking, okay, the brain is developing very rapidly in the first 3 years and it is, 80% is done by this time, 90% is done by 5 years. I want to get that intervention. Early intervention is key, right? Early intervention is key. If there's one message I can give all parents is early intervention makes a big difference. The earlier the child gets their diagnosis and therapy, the outcomes are so much better for that child. So by the time they go to kindergarten, they fare so well compared to if you do not get any treatments, therapies, leave alone just a diagnosis. You're diagnosed and you have to start therapy. So starting therapy early on is extremely important. So when they talk to me about a weight, and I sometimes get impatient. So it is about, especially when I'm concerned for the child. Especially when I'm concerned for the child. But there's a difference. There might be some times where I do want to work with the parents where there is a difference between passively waiting, but then actively monitoring that child too. So I think a brief period is pretty reasonable. Like you want to give a month or 2 months for the parents to integrate the information that you have shared with them. I can give you an example. And where I did use the I wait and see policy. So I had this parent. I was concerned for autism. The MCHAT was abnormal. We did the eye tracking technology that was abnormal. Clearly, there were clinical indicators saying that this kid is at high risk for a diagnosis of autism. I do not say, oh, your child has autism. You have to have the diagnostic testing done, the ADOS testing or CARS testing by the psychologist done to state that. So, but I do say, hey, your child is at high risk for a diagnosis of autism. So I did express my concern to the parents. There were some risk factors involved in there. The child was at home with the working parents. Both parents were working from home. So they thought, okay, why should I put my kid in daycare? I would rather save money on daycare and I would watch the kid from home. But mostly they were on their computers. They are probably busy with their work, right? But they had time to do basic care for the child. And so who was the babysitter? It was an electronic babysitter, right? It's the screen time, right? So obviously this child had a lot of developmental delays. So be it socialization, be it language, all of them, all of those aspects were delayed. So when I had all those developmental screenings, I'm showing them, hey, this is what's going on. This is why I'm concerned for your child. I have this screening also. That's why I'm concerned for your child. And I think the biggest risk factor here is, socialization. We need to get the child off the screen time and maybe in a daycare setting or maybe in a full-time daycare setting or as parents, I would have you engage, have specific time set for your work and make sure you take turns and maybe engage with the kid more. Maybe one parent is working, the other parent is not, and then you can switch maybe. So in that way, it is economically feasible for you. So we waited, we did a retest in 2 months, no change. And by that second month, I was like, I cannot wait anymore. I am sending to a psychologist. I'm putting all these referrals in. I had a firm feed down and then, but there was not much change in the lifestyle, because I think parents were still thinking about putting the kid in daycare. But by the third time, they got the kid in daycare and the final testing that we did 2 months ago, everything came back to normal, right? So they did zero screen time. They were so strict about the screen time. They started engaging with the child more. They enrolled him in daycare. They said, okay, the priorities kind of changed because they did not see any change in the kid. And so once they started doing those interventions, then the numbers changed, which means his risk came significantly down. His MCHAT got better, his eye tracking got better. We had objective measure of this child getting better. So I think we wait and see. You have to work with your pediatrician on that. I don't think sometimes I feel parents might go into that state of denial, but I want them to also understand that we are working with a brain that is growing very quickly and where that learning is very rapid in that first few years. We want to take advantage of that learning phase. So you definitely want to work with your pediatrician on that.
Amazing. I
Mhm.
love that case, and it really brings clarity, right? Because sometimes when you have it brings 2 things that I'm gonna really
Mhm.
emphasize here is that the
Mhm.
brain is developing rapidly in the first 2
Yes.
years. So that interaction is very important
Yes.
because the interaction or lack thereof can really, lead
Yes.
to developmental, delays and also with the high risk of autism where this kid just
Uh-huh.
needed that interaction. And
Correct.
I see
Yes.
that a
Uh-huh.
lot where,
Uh-huh.
we're working it's hard, right? But
Yes.
I like the suggestion of, taking turns, or even if you have to put the kid in daycare 2, 3
Mhm.
times a week for a few hours so that there is that interaction because it
Yes.
is part of that child's overall well-being.
That's correct. Yes. Well said. Yes.
Yeah. You didn't mention screen time. Tell me more about screen time in the developing brain.
Could be one of my favorite topics. The American Academy of Pediatrics does not recommend any screen time less than 2 years of age. It's a zero screen time. But the only screen time is if you're maybe like FaceTiming or Skyping, like a grandpa, grandma, you want to talk, you want to socialize, maybe that's the one screen time. But be it I think Einstein videos, it doesn't work. You don't want to do that for your child who's less than 2 years. And studies have shown not only the screen used by the child, but also if the parent uses more screen time in the presence of the child, it does affect their development too. So if parents are on their computers when instead of engaging with their child, the child is looking for engagement, but then doesn't see that and gets more object focused rather than going people focused. So I think it's very important not only for the child, but also for the parents to realize to decrease its screen time too.
Right, and it
Yeah.
reduces that social interaction that the brains
Yes.
need to form the connections they need to thrive.
Exactly. And
Yeah.
as I said, the brain is developing a million synapses a second. And, that chance is lost at that time. So that, and remember, the first 1,000 days of a life is so important in the child too. So all of these come under that. Not only nutrition comes into that first 1,000 days, but also that social interaction also comes into place there. I think if you have a chance to put that link for serve and return, I think that's a nice video that parents can watch
I'll put that in the
about
link.
yes,
So
yes.
if you have a patient, like autism, like you mentioned in your intro, graduating from med school back in the day where we didn't see a lot of autism, but now it has increased over the last few years for several reasons. Well, we can talk about that at some other point.
We
But
need a separate section for that.
yeah, but I'm saying that to say now because of that increase, there are lots of wait lists, right? Once we start putting them through, there by the time you send them for diagnostic testing with the adults with a psychologist, they may not get into an appointment for about 3 months, 6 months, and almost a year in some states. Well, how would you counsel a parent? How would you have them work with their kid, knowing that the brain is developing while they wait for that diagnostic testing?
It's such a wonderful question, Dr. Fendi. Yes. Because it is very practical, right? As a pediatrician, I remember 2020, that's why I'm here, right? It intrigued. I was frustrated, but then I started getting curious and I was getting more solution. I'm more of a solution oriented person. So I'm like, okay, what can I do? And now I have a nonprofit organization too, the Thrive Kids Foundation, where we are trying to increase awareness, education for chronic diseases in kids. So please check out thrivekidsfoundation.org also.
Yeah, and
So,
I'll put that in the link as well.
yeah,
What are
so
3 things you can tell the parent to do, like important things where like interacting with your kid, or what are 3 things you can do that is important to help them with their
mhm.
kid's developing brain while they're
Yes.
waiting for that diagnosis? Yes.
Yes, yes. First of all, I think there should not be a lot of wait time. So what I did as a pediatrician, I was trying my best to see how I can decrease that wait time. So I was connecting with the community, physicians and community specialists to get that way, and community providers like all the ABA centers. I would have personal connections with them to reduce that wait time, right? Because I wanted the best service for the kids that we care for. So even in COVID, I made sure that my wait for the wait time from the time of diagnosis for them getting therapy is not more than a month. So okay, we get see a psychologist maybe in 1 or 2 weeks, and then get that report and maybe set up a therapy in a couple 2 weeks. Otherwise, before that, it was 6 months, like you said. And people think, oh yeah, it's 6 months. But as I said, the baby's brain is developing very fast. I want to do my best to see how I can do my best in doing this. Of course, there are going to be some amount of delays, but we're going to do our best to help those kids. But for your question, like what are the 3 things that parents can do if they are concerned and there's something we already talked about, is making sure we are more engaged with the kids. We, stop or decrease screen time for sure. See how we can have more fun with the kid. Sometimes it's just, I see parents buy a lot of toys and have the kids play with toys, and then the kids get more object focused, pattern focused, rather than people focused. So I say parents, just take off all the toys from the room. Okay. Just have like maybe a little couch, maybe a little ball, or maybe just a book, and play a tickle game with the kid, have fun with the kid, peekaboo, get a hide and seek, maybe. So engage a lot more with the kid. But then even if there's an object involved, let there be like a 3-way communication. It's like, we're just not, reading A for apple, B for bear. But then, hey, did you see the apple? How is the apple? Is the apple yummy? Or is he a red apple? You want to kind of like build up on that book or that object. You want to have more fun with it. It has to be more 3-way communication going on in there. And you want to see that engagement from the kid too. You want to make eye contact with the kid. You want to get that object. So you want those play skills going on early on with the child. The third thing I would say is nutrition. Again, I can talk about nutrition for 8 hours. I don't know, for a long time. That's why your question kind of like, okay, I have to talk so many things. Where do I start? So where do
We
I
have to
start?
do a next one. We'll do a series on
Yes,
this. Yes.
yes. Because, the question involves, helping the pediatricians understand how can we reduce that wait time, and having policymakers understand how we can reduce the wait time, diagnosticians understand, and, how can we help parents here. So the third thing is about nutrition. Such a big topic. I think we should have a separate section on nutrition. But make sure your kids are eating at least 2 cups of fruits, right? At least 3 cups of vegetables, at least. And I wouldn't do a lot of definitely no processed foods, right? No fried, processed foods with colors, dyes, preservatives. You want to definitely get those off from the child's diet. Milk can be a big topic when we talk about autism, and we can have a separate conversation with regards to how in some kids it can affect. Again, it depends upon the biology, some testing that we do to see which kids need we need to have the specific meal planning. So we actually have a nutritionist in our clinic who works with the kids because these kids can be picky eaters. They have several nutritional deficiencies, and that's why I say it's such an important topic. We see a lot of nutritional deficiencies in these kids, commonly iron deficiency, zinc deficiency, vitamin D deficiencies. We look into something called carnitine. There's carnitine deficiency. There's a lot of nutrient deficiencies playing a part here. And God, you're going to get me started here. So, but why is there such a big nutritional deficiency? Like, even if you're eating, like, even if you say you're eating two fruits and 3 vegetables a day, you're still going to be nutritionally deficient. I'm a vegan. I eat a lot of fruits and vegetables, but still I have some nutrient deficiencies, right? It's
Right.
because the food also, the nutrients in the food have come down because of our agricultural practices, the farming practices, the soil health, all of those play a part. And that's why I have the foundation, my Thrive Kids Foundation, because I wanted to bring that awareness and education. I said, okay, if there is a child with a chronic disease, be it a neurodevelopmental disorder, be it allergies, be it Crohn's disease, or cancer, all of those rates are getting more and more as the years go by. But the health of the child is a direct reflection of the health of the planet. So I think if your child needs to be healthy, the planet needs to be healthy too, for the food that comes from the planet to be healthy, and for you to be able to provide that good food and nutrition for your child, for you not to get those nutritional deficiencies, and that to help the brain to develop better.
Awesome. Thank you. So
Mhm.
social interaction is really important. We want
Yes.
to make sure that we're communicating with our kids. We're not allowing devices to do what we need to do. There's a place for that, like you said,
Mhm.
but we have to really be in their face, talking to them, interacting. And then
Mhm.
also, because a lot of times we say autism, we go with the speech, we go with the social emotional connection, and then we forget that other systems are
Mhm.
affected too, like you mentioned, nutrition, which is a big, huge part of autism, plus other things like you rightly said, the huge topic, which is why I'm going to invite you back. I talk to a lot of kids who are picky too. And like you said, the highly processed foods, the brain is developing. Most of those are neurotoxins, and you can't have the neurotoxins in there with a developing brain. So
Yes. It's
we
a very controversial topic too, because the food industry is also involved here. So, but we're only going to talk about what you need to eat, which is lots of fruits and vegetables. Let's
correct.
focus on that. Yes.
Correct. Yeah. So we can talk because I mean, and granted, for a parent who has a kid who is autistic, most of them have sensory sensitivities where even feeding the kid is difficult. So sometimes they're like, "Oh, my pediatrician said eat the rainbow, and I've tried. I've given this kid everything, but they will not
Yes.
touch it."
Yes.
So
Yes.
that's a huge thing when it comes with the diagnosis of autism and picky eating, or delay, or sensory sensitivities and stuff, which I know we've talked a lot, we've provided a lot of information. I hope you've gotten value from this, but we will come back and talk more about autism, maybe go with the GI and stuff, but we will come back as a series to provide you more information, how to feed your autistic kid. That may be the next topic. What do you think?
Yes. Yes. And I would like to hear from the parents who are watching this what topics they would be interested in learning more about. And I know there is knowledge out there. It's not about the knowledge, remember, it's about execution of the knowledge.
Right, which is why we try to keep it as practical as we could.
Yes.
What can you look for at home? What can you do to help your kid thrive? Ultimately, that's what we want. We want for your kid to thrive, diagnosis or no diagnosis. Because I've seen a few parents too who not want it because they don't want that label. It's not about a label. It's about how can I be there for my kid? What do I need to know in order to provide what my kid needs to thrive?
Yes, that's correct. Yes. Well said. Yes.
Okay. All right. Thank you for joining me today. If we have a parent who absolutely loves what you do and the kids you see in clinic and they want to find you, where can they find you?
So my practice is Pediatric Associates of Frisco. Our website is pediatricsfrisco.com. You can request for appointments directly from our website, be it a new patient or established patient. We are there to help you out. We have two other providers in our practice, and we are based in Frisco, which is one of the suburbs in Dallas, Texas. Please also check out our nonprofit organization, which is thrivekidsfoundation.org. And we would love to partner with the community members to help educate and bring awareness to the community about the chronic diseases in children.
Awesome. Awesome. Thank you. You provided so many valuable resources, and I will be sure to put them in in the link when I upload the YouTube video. Thank you for joining me, and I'll see you soon again for
Yes.
round.
Yes. Thank you, Dr. Fendi. Yes, it was a pleasure, talking to you and, exchanging all this information.